Our guest today is Phillip Dowdy, a podiatrist at Our Lady of Bellefonte Hospital and here in the Bellefonte Center. Phillip, tell us a little bit about, I know you went to Russell High School, but talk about your college and your medical school and things of that nature.
Okay. Like you said, I went to Russell. I graduated from Russell High School in 1995. After that, I went on to college at a small school in South Carolina called Coker College. It's C-O-K-E-R, Coker. And went there and actually got a tennis and academic scholarship to go down and play tennis and study. Ended up getting a degree in chemistry. Messed around with business. I had a little bit of, almost a full minor in business. Wasn't a full minor, but almost a minor in business. And after that, I came back home for a little bit. I wasn't sure what I wanted to do, and worked on my MBA for a little bit at Marshall. Actually, didn't finish that, but I started some classes there, and then decided I wanted to become a doctor. And went to podiatry school after that in Miami, Florida, at a place called Barry University in Miami Shores, Florida. I was there for my podiatry school, and after that, I did my residency training in Detroit at Henry Ford Hospital. Did a 3-year surgery program there, and then I came back to Kentucky. I was in Somerset, Kentucky, and did a fellowship year. I did that in diabetic limb salvage and wound care, and that was affiliated with Jewish Hospital. But I mainly spent most of my time at Lake Cumberland Regional Hospital in Somerset, but some time at Jewish as well. And then after that training was completed, I got my first, what I call, real job. I got that here at Bellefonte, and I've been here ever since.
A fair disclaimer is, Phillip is my podiatrist, and in fact, there was a podiatrist at Lake Cumberland that I went to, so I've been to both places. So Phillip, podiatry is a specialty type thing.
Yes.
So why don't we talk about that and what you can and can't do surgery on, or will and won't. Let's not say can and can't. Let's say will and won't do.
Okay. Well, surgery ranges a little bit in the field of podiatry, and actually even ranges from state to state, sometimes being on the rules and regulations. But overall, almost anything from the ankle down is what most podiatrists do in most states. Now myself, I did some ankle training and surgery in Detroit, but I really don't do a lot of ankle surgery here. I focus most of what I call on the forefoot, which is basically from the middle part of the foot, which I consider the metatarsals, and forward when it comes to bone work. That's kind of more technical speak, but that involves bunions, hammer toes, spurs, cystic areas on the foot, soft tissue work on the foot. Unfortunately, it involves amputations too sometimes for my diabetic patients, and procedures similar to that. They're more, but they're kind of escaping in my head without naming them all off. But I basically kind of focus surgically from what I consider the midfoot forward to the toes. Now, other podiatrists can also do more work than that. I just kind of specialized myself into that niche, I guess you could say.
Of course, I am diabetic. I've made it well known. I write about it and I talk about it because I think people who are and don't take care of themselves, and their feet are a very important part of diabetic treatment.
Right.
Some just don't do, or they wait too long.
Right. Well, that's a big problem. Part of the problem with my diabetic patient, and getting back to that, of course, surgically, I deal a lot with diabetic wounds and ulcerations and complications of the foot. And that's a big part of my practice here. We do have a big diabetic population in the area. I think there's multiple facets to the problem. I think some of it is education. Some patients don't understand what they need to do. Some patients just don't do it. It's a little bit of non-compliance. And then the culture here is not that it's a bad culture, but our family's involved a lot around food, a lot around churches, things like that, which is fine, but can lead sometimes to overeating and maybe not eating the best food in the world. But right. We all fall into that trap. I mean, I fall into it myself, so I kind of have to watch and step back sometimes from the eating. But it leads to that, and then can lead to multiple problems as you get older, unfortunately. But diabetes is a big problem, and I try to tackle it the best I can here. But of course, it's a problem.
So let's move forward now. You've been with the hospital for about 4 years. You told me a minute ago. You were across the hall here at the Bellefonte Center. Let's talk about your new office, what it offers to you and patients, the open house that's coming up.
Well, we have an open house coming up. I believe it's January 29th. It's a Thursday from 4 to 6. If I have my dates right. I'll lean on my office manager to help me with some of those dates. But
that is right.
Yeah.
I read it this morning.
Yeah, but anyway, we did. I've wanted a new office for a while. When we first started out, we had a nice office. It wasn't extremely large, but it was what we needed at the time. I outgrew that fairly quickly, but sometimes it just takes time to get a new space, and now we have a new, bigger space, a much bigger waiting room for our patients, more exam rooms, newer chairs, which was a big need we had, and just overall nicer office for our staff as well, more room to get around. We made that move, I guess right before Thanksgiving we made the move, and have now gotten settled in, and things are pretty much up and running and ready for an open house.
So you feel that your practice is going in the direction you'd like it to?
Yes, it's going very well, and even hopefully the future we're relatively busy. I'm maybe hoping to get some help at some point.
That'll be great. It'll be great. Phillip, thank you very much.
Mm-hmm.